In this video, we will talk about semaglutide, the new medicine that helps you to lose weight. And if you are looking for an edge when it comes to losing weight, semaglutide may be the answer. This cutting-edge medication has been making waves in the medical community, and people are eager to know if it is right for them. So keep watching to learn all you need to know about its potential side effects and who can benefit from it. And at the end of the video, I will reveal some very important points regarding this drug so you can decide if it is worth trying or not. Semaglutide is a glucagon-like peptide-1 receptor agonist that was initially developed to treat type 2 diabetes. It was later approved for the treatment of obesity. It is available under the brand name Ozempic, when used to treat diabetes, and Wegovy, when used to treat weight management. The drug was derived from the popular diabetes drug Ozempic and was later approved by the FDA. In June 2021, as the first new weight loss drug in over a decade, semaglutide is a once-weekly injectable medication, stimulates the release of insulin only when blood sugar is high and suppresses the release of insulin when blood sugar is low. It also slows down the rate of gastric emptying, which results in prolonged satiety and reduced food intake. Semaglutide was investigated in the PIONEER trials as an effective treatment for reducing weight and improving glycemic control in patients with type 2 diabetes. These trials demonstrated that semaglutide significantly improved glycemic control compared to placebo in patients with type 2 diabetes. Some patients even achieved remission of type 2 diabetes. During the study, patients receiving fasting glucose levels and body weight. Researchers found that semaglutide significantly reduced body weight compared to placebo in adults with overweight or obesity without diabetes. In the 68-week study, the semaglutide group lost an average of 14.9% of their body weight compared to 2.4% in the placebo group. About 86% of participants in the semaglutide group lost at least 5% of their body weight, and about 50% lost 15% or more. According to the study published in NE, semaglutide significantly reduced weight and waist circumference, lowered blood pressure and lipid levels, and decreased inflammatory markers. In another study involving over 2,000 participants with cardiovascular disease or diabetes, semaglutide significantly reduced the risk of major cardiovascular events, including heart attacks, strokes, and cardiovascular death. After 34 weeks of treatment, participants receiving semaglutide experienced a 25% relative reduction in the primary composite endpoint of cardiovascular death, non-fatal myocardial infarction, and non-fatal stroke compared to placebo. Beyond its efficacy, semaglutide is also well tolerated. The most common side effects are nausea, diarrhea, and constipation, which are usually mild to moderate and temporary. In the double-blind placebo-controlled trials involving over 2,500 adults with overweight or obesity without diabetes, less than 2% of patients discontinued treatment due to adverse events. Nausea was the most common reason for discontinuation, occurring in approximately 1.6% of patients in the group compared to 0.3% in the placebo group. Most of these side effects tend to disappear after a few weeks of starting the treatment. So what does this mean for you? If you've been struggling to lose weight or manage your blood sugar levels, semaglutide may offer a glimmer of hope. This new medication has shown incredible results in helping people achieve their weight loss goals and improve their overall health. But before you rush out to get your hands on this new wonder drug, there are a few things you need to consider. For starters, like any medication, semaglutide can cause side effects. While most of these side effects are mild and temporary, some patients have reported experiencing serious side effects such as pancreatitis and kidney problems. Additionally, semaglutide is not a magic bullet. It's not going to melt away the pounds without any effort on your part. You still need to be willing to make changes to your diet and exercise habits in order to see results. And finally, semaglutide is a relatively new drug, so there is still a lot that we don't know about it. Long-term studies are needed to determine its safety and effectiveness. So while semaglutide shows promise as a new treatment option for weight loss, it's important to weigh the pros and cons before making a decision. When it comes to treating type 2 diabetes, semaglutide has shown remarkable results. In a clinical study, patients with type 2 diabetes who had a significant improvement in glycemic control compared to those who received placebo. What's more, some patients even achieved complete remission of type 2 diabetes, bringing their blood sugar levels back within the normal range without the need for any additional medication. This is a huge deal because it means that semaglutide could help people with type 2 diabetes live healthier lives by reducing their reliance on multiple medications. But the benefits of semaglutide don't stop there. The same clinical study also found that semaglutide helped patients with type 2 diabetes lose weight, which is important because obesity is a risk factor for a number of other chronic conditions. By shedding extra pounds, patients not only improve their appearance, but also reduce their risk of developing heart disease, stroke, and type 2 diabetes. This dual benefit of controlling blood sugar levels and losing weight makes semaglutide an attractive treatment option for many people with type 2 diabetes. It offers the promise of a better quality of life, reduced risk of complications, and fewer medications to manage their condition. For those looking to improve their health and well-being, as a doctor, I am excited about the potential of semaglutide to help my patients with type 2 diabetes and obesity. The results from the recent clinical trials are truly impressive, and I look forward to incorporating this new tool into my practice. However, it is important to remember that every patient is different, and what works for one may not work for another. That's why I will take a personalized approach to treatment, taking into account each patient's unique needs and preferences when deciding whether semaglutide is right for them. Ultimately, my goal is to help my patients achieve their health and weight loss goals in a safe and effective manner. And with the addition of semaglutide to our treatment options, I am confident that we can help more patients achieve their goals than ever before. So what are my final thoughts on semaglutide? I believe it is a game changer in the field of weight loss and diabetes management. The results from the clinical trials are impressive, and it has the potential to help countless individuals who struggle with their weight or manage their blood sugar levels. However, it is not a miracle drug, and it is important to have realistic expectations. Like any medication, it comes with potential side effects, and it is not a substitute for a healthy lifestyle. But for those who are willing to give it a try, semaglutide may be the answer they've been searching for. If you are considering it is crucial to consult with a healthcare professional to ensure it is safe and appropriate for you. They can help you weigh the risks and benefits and determine the right dosage for your needs. Remember, semaglutide is a powerful tool, but it is up to you to decide whether it is the right fit for you. I encourage you to do your research, ask questions, and make an informed decision that aligns with your values and goals. Don't let this opportunity pass you by. Take control of your health today and discover the amazing benefits of semaglutide. Thank you for watching the video and subscribing to the channel. I hope you enjoyed the video and learned something new. Please leave a comment below if you have any questions or comments about the video. I would love to hear from you. Thank you again for watching and subscribing, and I will see you in the next video.